right, thanks for joining us on Health Focus. It's so good and great to be back. I am Mudupoluwa Shoremekun Ogunjobi. There has been an unusual rise in the number of children and teenagers around the world diagnosed with type 1 diabetes since COVID, and this according to some researchers. But more work is needed to understand why the rise is happening. Just for you to know, people with the condition have to closely monitor their blood sugar level and take insulin to control it, because their body cannot do this automatically. And that's because insulin-producing cells in the pancreas are mistakenly destroyed by body's immune system. So it occurs in children and adults, but the causes are not fully known, and there is currently no cure. So you need to take note of that, and maybe you can just run that check for your children and your teenagers, depending on what the situation is at time. Now let's take you through the top health news for the week, and when we come back, Health Focus continues. To stay with us.
The Nigerian Center for Disease Control and Prevention has revealed that the country has recorded 798 diphtheria cases in 8 states across the 3 local government areas in the country, while the number of deaths has risen to 80, with a case fatality ratio of 10% as of June 30, 2023. The NCDC disclosed this on Thursday in a press statement signed by its Director General, Dr. Fejiro Chinye, following the first reported confirmed case of diphtheria in the Federal Capital Territory, Abuja. It said as of July 3, 2023, only 1 confirmed case has been detected in the FCT, with 7 suspected cases testing negative, while others are awaiting laboratory results. In response to high demand for the first ever malaria vaccine, 12 countries in Africa will be allocated a total of 18 million doses of RTSS for the 2023-2025 period. Malaria Vaccine Implementation Program countries Ghana, Kenya, and Malawi will receive doses to continue vaccinations in pilot areas. Allocations were also made for new introductions in Benin, Burkina Faso, Burundi, Cameroon, Democratic Republic of Congo, Liberia, Niger, Sierra Leone, and Uganda. A study suggests smartwatches might help diagnose Parkinson's disease up to 7 years ahead of symptoms. The UK Dementia Research Institute team at Cardiff University used artificial intelligence to analyze data from 103,712 smartwatch wearers, and by tracking their speed of movement over a single week between 2013 and 2016, they were able to predict which would go on to develop Parkinson's. It is hoped that this could ultimately be used as a screening tool, but more studies comparing these findings with other data gathered around the world are needed to check how accurate this will be. And that's it on Health News for this week. It's back to the studio.
For every health information you need,
Nigeria has the highest burden of sickle cell in the world. There's no reason our patients who can afford to access this treatment should be going abroad.
Your health queries.
No matter what your test result says, if you've been trying for 1 year and you are not successful, then you need to see a doctor. After 2 years, everybody should be doing something.
Policies on access to care.
Everything we do in Nigeria is about punishment. We never think about the other side. Do we offer a different perspective before we begin to punish? The first thing is punitive.
Let's make sense of every health matter locally and globally. On Health Focus, join us. The recent news of cases of diphtheria, a bacterial infection caused by the bacterium called Corynebacterium species that affects the nose, throat, and sometimes the skin of an individual, was shocking, as it was the least outbreak expected at this time. The symptoms are fever, sore throat, runny nose, cough, red eyes, and neck swelling. In severe cases, NCDC said that a thick gray or white patch appears on the tonsils and or the back of the throat. While NSSF is working to contain the spread of the disease, do know that diphtheria is a vaccine-preventable disease that is scheduled on childhood immunization list. The schedule recommends 3 doses of pentavalent vaccine, a diphtheria toxoid-containing vaccine, for children in the 6th, 10th, and 14th week of life. You may cross-check your child's immunization records to know if they were vaccinated against diphtheria. However, the prevention routine remains washing of hands regularly, use of nose masks in public places, and maintaining social distance where necessary.
Craniofacial malfunctions are the results of an infant's skull or facial bones fusing together too soon or in an abnormal way. With over 5,000 patients successfully operated upon in Nigeria, with the support of Cleft and Facial Deformity Foundation, experts believe that there is an urgent need to establish School of Dentistry at the University of Abuja to scale up services and attend to more patients, especially the poor.
If we are able to have Abuja craniofacial, what will be the focus is microvascular reconstruction, where you be able to take a bone with the blood vessel and anastomose it and be able to put implant the same day. That's the height of reconstruction in maxillofacial surgery.
The significance lies in the fact that happiness is being brought to those who have been made unhappy because of facial deformities.
With just 10 schools of dentistry across Nigeria, producing less than 250 dentists yearly, the experts noted that there is a need for a deliberate effort to increase the workforce by producing more dentists and maxillofacial surgeons across the country.
The target is actually to be able to do about 50 cases for this tournament. But we have done 13 now and the operation still continues, so we'll see when we can stop. Because many people have the problem but they don't have the money. So you have many people, there's a lady in the world been going about, a 27-year-old, I've been going about with this swelling for 12 years. Definitely something must be wrong.
We are impressed with the turnout of the patient, and we are also impressed with the number of surgeries that have already occurred.
For the experts, the creation of the Abuja Craniofacial Hospital for the needy is a long dream of the Cleft Foundation to establish a specialist hospital where indigent patients with facial diseases can receive succor.
For every health information you need,
Nigeria has the highest burden of sickle cell in the world. There's no reason our patients who can afford to access this treatment should be going abroad.
your health queries,
No matter what your test result says, if you've been trying for 1 year and you are not successful, then you need to see a doctor. You know, after 2 years, everybody should be doing something.
policies on access to care.
Everything we do in Nigeria is about punishment. We never think about the other side. Do we offer a different perspective before we begin to punish? The first thing is punitive.
Let's make sense of every health matter locally and globally. On Health Focus, join us. Welcome back. Well, Nigeria's healthcare system has been bedeviled with a lot of challenges, which I'm sure that many people know, and is affecting the health outcomes of the vulnerable. Now, let's speak to the CEO of NSSF, Dr. Fejiro Chinye Nwoko, on how much should be done to improve the health systems, help the vulnerable, and what government needs to do to turn around the healthcare sector into a viable and reliable one. Tell us about NSSF and give us a few reasons why you think Nigerians, especially the vulnerable, need your contribution at this time.
NSSF is a non-for-profit organization. We're vetted as a result of a partnership between Global Citizens and the Nigerian Sovereign Investment Authority in 2020 during the COVID pandemic. And the mission for NSSF was to empower, or is to empower, organizations through innovative approaches, collaborations and partnerships to strengthen health for the vulnerable people and communities. And so our focus is on actually strengthening the health system for vulnerable people. And what we do in NSSF, our focus right now is on improving vaccine routine immunization for children. And that's because vaccine preventable disease causes 20% of under 5 mortality in the world. And Nigeria has one of the highest rates of unimmunized children. We have over 4 million children unimmunized in the world. The vaccine coverage rate, the target is at 90% by the WHO, and Nigeria currently is at 54%, meaning that there is still a huge gap. So what we are doing in NSSF is to improve the uptake of routine childhood immunization for children under 5, and thereby reducing the mortality rate of under 5 children in Nigeria. We're hoping that that would in turn strengthen the health system and relieve the health system of the expenditure as a result of illnesses that result in this age group. Vaccines are one of the most cost-effective public health programs in the world because of its preventive nature, and so we're hoping to strengthen the health systems through that, and we've done that in 2 years actually. In strengthening health systems, we have the health financing bit, and what we do is to fund programs. So how we fund programs is to work with government agencies to fund the program. Most of the health programs, especially for children, are maternal and newborn care, and they're integrated. So we're strengthening the human resource for health by training them. We're strengthening the health services by improving data use for decision making and for accountability, and that in itself it affects the pregnant woman and through that delivery process and postpartum process.
How does the organization identify these vulnerable, and what are the parameters of selection?
That's a very interesting question, because that also speaks to the weakness of some of our, why the health system in Nigeria is weak. And one area that we're weak in is in data and data keeping, where our data process is still very manual. So currently how we identify vulnerabilities using data. There is no other transparent and objective way to identify vulnerable people other than using data. But we know that the data is not optimized in the sense that there's a lot of incomplete data, missing data, late upload of data into the database. And so one of our intervention is also strengthening data through this process. But currently we use the data available in the DHIS and the data that is used by the NPCD, which is National Primary Healthcare Development Agency. They conduct surveys quarterly on the different communities in Nigeria, and based on that survey they classify communities that are weak and communities that are strong, and so we use those data to intervene currently. But we also know that data needs to be improved to become more electronic based and more real time.
Any partnership with UNICEF?
Currently, we don't have a partnership with UNICEF, but we are in talks with them. We're having conversations with them because we know that they also play a lot of role in terms of vaccinations. So we are in conversations with them to work together, to partner together to improve the uptake. We're working with the National Primary Healthcare Development Agency, which brings everybody to a room. And so we are in that room. There is a NERIC meeting that is for all the donor partners that are involved with routine immunization. And we are together in that room working with the NPCDA. So we are all collaborating with the NPCDA to improve the uptake.
What's your achievement as regards improving the health outcomes of vulnerable Nigerians and underserved communities?
So we've done 3 main things. We've done trainings of healthcare workers. We have done the advocacy campaigns where we try to reduce vaccine hesitancy, the myths and the beliefs around not use of vaccines. So we've done the advocacy campaign, and we have improved the logistics of vaccines to the last mile to very hard to reach areas by creating funds for logistics move. So in terms of trainings, we have achieved over 12,000 training. We have been able to train over 12,000 healthcare workers in Nigeria. We have been able to our
in
advocacy.
How many years?
We did that in 1 year, 2021/2022. So we did that in 1 year. Our advocacy campaign, we did a lot of advocacy in terms of jingles. We had mobilization in the rural community, and we're able to reach over 12 million Nigerians in trying to improve their knowledge on health education, on vaccine, why vaccines are acceptable and why they are best. And in terms of donations for logistics, we donated over 300 million in 2021 for the move of vaccines to the last hard to reach areas, which was able to vaccinate over 4.9 million people.
Based on your findings and expertise, what are the things responsible for the drawbacks we have presently in the healthcare sector, and how can we solve some of these challenges?
Okay, so there are multifactorial reasons, right? So not just one thing is responsible. There's a myriad of factors leading to poor healthcare, and so I would like to look at it using the health systems block. And the first is health governance. Governance for health. We know the challenge we have with good governance in the country as a whole, and that trickles down in healthcare. And when the governance structure is not in a way that there is accountability for whatever work you do, and it's not in a transparent manner, and leaders are not held accountable for their jobs, and even they're not as small as KPIs to what are you supposed to achieve in office when you're in office. So the leadership for health has been based on your personal moral system, rather than a clear set of goals and repercussions if you don't follow that. And that has greatly weakened the health system. So if you have a health leader that wants the good of the people, you may get some results. But if it's succeeded by somebody that really doesn't care, you may not get a lot of results. And that has not helped the country. Another area that we're lacking is in financing. The budgetary allocation for health is still suboptimal. As the African Union had advised that at least 50% of the budget should go to health. But up to last year, our budgetary allocation was still less than 5%. And that's just allocation. That is not even expenditure. Expenditure would not even be less than the allocation. And that is a big issue because we are still depending on government to finance health largely. We have not gotten into universal health coverage where everyone has some form of health insurance, so everyone contributes to their health investment. So we're not there yet. So government is still the primary funder for health, and the funding is very limited. And when there is no funding, there's dilapidation. So we see that just 20% of the PHCs in Nigeria are functioning at the standard they should be functioning. The others are functioning below standard, either infrastructure-wise, extremely below, either infrastructure-wise, or even hours of opening, or even manpower, and all of that. Another major area we have problem with is human resource for health. A lot of our manpower is we're not training as much healthcare workers as before, as several years back. Our healthcare workers are also migrating, both internally in Nigeria, so migrating from rural to urban areas, or migrating out of the country. So we have that migration, so the rural areas suffer more than the urban areas. And then there is the issue of loss of experience. So we don't have as much experienced hands to mentor than the ones that are just graduating from school, and so that has weakened this sort of expertise that we have. So even beyond the number, even the expertise that we have is poor. And then we look at data again, like I mentioned. Data is supposed to help with innovation. Data is supposed to help with creating programs. And so if our data system is still poor, then we know that we can't improve much. So
do you think this new administration can do any magic, can turn things around and help improve the healthcare sector as much as we need, following the goals and the plans that they have on ground.
Cabinet at least has not been announced.
Yeah.
And the policy for health, well, I don't think that it has been clearly elaborated on this policy. So it's quite early to say, but
it has promised 40% universal coverage, health coverage. Do you think that's possible in 2 years?
So that, again, like I said, the implementation plan has not been. We just know the goals, but we don't know how is it going to be achieved. That has not come out. The framework for implementation is still missing, and that's why I said it's too early to say. It's okay, any goals can be achieved, and goals should be ambitious. So I like that it's an ambitious goal. I like that it will force us to think outside the box. Yeah. It will drive us to work. It will help us close a lot of gaps. If we don't even achieve the goal, we would have moved from where we are. So I like it. But I think that what should then be quickly followed is what is the framework for implementation based on our own context. So not a framework that is imported from outside the country, based on our own context, based on what has failed over the years, based on what has worked in whatever small scale over the years. That is what I think should be brought into the framework, and of course it has to be a room where multi-stakeholders are looking into it. But I'm hopeful. I'm hopeful because a lot has happened in less than how many 1 month
yes.
of this administration.
Yes.
A lot has happened, so I'm hopeful that something may happen.
Let's sit on that hope and hope that we get something out of it. Thank you very much for your time.
Thank you for having me.
Well, and that's how much we can take on Health Focus. Remember to send a DM via Twitter and Instagram handle at @ExperienceMo. Just hashtag Health Focus in case you have any difficulty in access to care or there are some topics you would like us to discuss and speak to professionals. You can always send a DM to us at @ExperienceMo. Thank you so much for watching this week. We'll be back here again next week to give you all that you need about health in Nigeria and in the world. I am Fejiro Chinye Nwoko, and bye for now.